when you add 50 million more insured to our health system without adding additional doctors, do you think we have rationing of care?
What some people don't realize, there's already rationing of care. Medicare, they set the fee schedule. If they don't want a procedure done, they'll just keep lowering the rate until it's not being done. Most people, they don't even realize that a bypass now, just think about in your own circumstance, 20 years ago, there was many people getting bypassed. They don't get bypassed anymore because the surgeon gets a little over $1,000. That's to do the procedure and then the follow-up for 3 months afterwards. So there's already rationing of care. And I don't think that the government, they're really not good stewards of our money that we're giving them already. I don't know why we would want to give them any more of our money. One of the things that's perplexed me, there's a government website, AHRQ, the Agency for Healthcare Research and Quality. It goes through a list of disease states, almost any disease state, you can find it there. It tells you the best ways to treat that disease state. But Medicare doesn't pay for the best way to treat many disease states. And you have to ask yourself why. I don't know. But I think that's part of rationing of care.
Right now, as we already have people that are rationing care. It's really difficult. In a big metropolitan city like Houston, you can probably find a doctor or a specialist that is on your plan. If you're underinsured, uninsured, you go to see the first one that you are. If you get to a plan that you're either going to be adopted into, you should get off your plan to be one of these plans. Or if you're a new person into this plan, that's what you're talking about, 50 million people into the insurance sort of line. I think we are going to have, initially, we are going to have lines. We're going to have not rational care, we're just going to have a line, a queue. We cannot put any more doctors through right now because that's, again, a government-mandated system. We have only so many medical schools in the country that can only put out so many medical students. Oftentimes, and even the Army's doing it right now, we're outsourcing. We're bringing people in from other countries and offering them when they are here legally and offering them citizenship early so they can enroll in our armed forces because even we're short over there. So we are short everywhere because we have such a narrow system. We've had a nursing shortage for years. We only have so many qualified places that we can train professionals. We're going to add into that. We're either going to increase the line for those people to get that care, or initially we're going to do that. But at the end, I think if we get good preventive medicine, as Dr. Olson has alluded to, that line is going to reduce down because you are going to be healthy. You're not going to need that many doctor visits. Right now, we provide the greatest sick care, but we don't do so well on preventive health care. We do great when you're sick. This is the country to be in. We will save you. But if you're healthy and you want to stay healthy, we're not the greatest people to advocate that right now. There's just not money's out there. And we follow the dollar. That's what it's all about.
I skipped the bill. I have to honestly say I didn't read it word for word. It doesn't specifically say ration. However, if you have X number of dollars and you have X number of people to take care of, the only way you cut costs is you have to cut on procedures or the number of people you take care of. Not bashing any other country, but if I lived in England and I needed dialysis, I would not get a bus ticket. I am too old. If you're over 60, you don't get a bus ticket. You don't get shut off at 60. But I'm already 70 and I've been around a long time. But so that even though it doesn't say it specifically, we need to make sure that the system we have has safeguards.
Build a little bit on the idea of rationing care, because I think the real issue, and we're all struggling with the fact that costs are going up, and having been in the business of trying to financed healthcare for the last 30 years or so, the issue is not how much you pay doctors. We should actually pay doctors more, but what we all have to do, and this is one of the really hard things that we have to collectively work on, is rationalizing the care that we get. And a big part of that is getting the right care at the right time. And as several of the doctors have said, moving away from sick care to preventive care. The best example that I can do is I see this 1,000 times a year in our health plan. We have a lot of young women that have babies, and in fact, we financed 26,000 births last year here in the Houston area through Medicaid and CHIP and our CHIP perinatal program. And we basically figured the way that things work for us is if we can find young, poor women and get them prenatal care and spend $500 on good prenatal care for them, we avoid a $250,000 or $500,000 premature baby being born. And there's so many other examples of that all the way through medicine that we need to have patients who take personal accountability for their health and say this is important, and have them talking to a physician about what they really need to do, what really works, what isn't necessary, because I know there's also patient demand, and physicians get not just bombarded from the government, but they also get patients who say, well, don't I need this test, don't I need this test, don't I need this test. We have a lot of opportunities to have less care given that isn't helping people's outcome be better, and that's the rationalizing of care that we need to do. This not rationing, not rationing by the government, but rationalizing the care between patient and doctor in that doctor's office. That's where it gets